when they are leave from Bal Vihar for college life and also the career options. So we made that connection. We are going to continue that, and this year we have the expanded program. And Anita Bhatt, like is leading that program with J-Chicks. So J-Chicks are leading that program, and they need your help. Then that we are going to cover that, how we can help in that way to make our kids, Bal Vihar students, ready when they are graduate from Bal Vihar. So today we have two great topics. The first topic is it's always in parents' mind and high school students' mind, college admissions. There are different pathways you can get into college and choose a career option. There is no one pathway that fits for every kid, because there's a lot of different ways you can get into colleges. And there's no magic bullet, as you know. So the admission process is changing. And today we have Dr. Brinda Subramaniam, who will be talking one of those pathways. And if there is an interest, we can have additional sessions for other pathways. How do we get into other schools or private schools, and what parents have learned and do's and don'ts. So a lot of CMLA members have a lot of experience, so we can have additional sessions. So Dr. Brinda Subramaniam, she taught physics in Cal State system, Cal State Los Angeles for almost 10 years. And then she transitioned to community college system in Cypress Community College. And she teaches engineering there. So since she has experience in two different educational platforms, Cal State and community college. So her passion is to mentor and counsel students on a particular path where they can have a college education. And she has been a CMLA member for multiple decades, and her kids went through Bal Vihar and Shruti class here. And now she dedicates her time to help CMLA members and the community to help and mentor students in college education. I welcome Brinda ji to come on the stage and give her talk.
Thank you, Bharatji, for a great introduction. As you know, my name is Brinda Subramaniam, and I'm here to talk to young minds. Do we have 11th and 12th graders? Okay. To the young minds who are ready to embark on their journey to college or university of their choice, and also to the parents. My idea is to present different ways of going to the college and not get disappointed. If you don't get into the college of your choice, what are the other alternatives? So I'm going to explain all those things, and he already told you about my experience of teaching at Cal State system as well as the community college system. So what is the goal? Goal is common to all of you, that you want to finish after high school, you want to attend college, get a degree in your choice of field, in a field of your choice, with minimum loans, and start working, live the American dream, or you help the community and the world at large. The choice is yours. So the California state has one of the greatest higher education system. We provide very high standard education at an affordable cost, and we have 3-tier system within our higher education after high school. If you want to go to community college and then transfer out to Cal State, go to community college and then transfer out to UC, or go straight to Cal State or go straight to UC. So there are different steps. And our state, we also believe in giving second chance to all our future generation. So if you don't get into your choice place, your choice of university, that's not the end of it. There are many other options, and you can take a different path and get to the same school that you wanted to go after high school. If you don't get into your dream school after high school, that is not the end. It's just the beginning. You're taking a different route than some other people, that's all. So there are three options. You can join University of California system or some private university, or you can join California State University system, where we have about 23 campuses within our state, or you can join community college system for 2 years and then transfer out to a 4-year school and then continue your education and get the degree within 2 or 3 years. It depends on your progress. There are community colleges in every city. Right here in Orange County, we have Irvine Valley College, Orange Coast College, Saddleback College. In South Orange County, North Orange County, we have Cypress College, Fullerton College. So there are multiple colleges very close to where you live, so that's another option. What is the difference between these three systems? One is the cost. Community colleges, it costs about $46 per unit, and then CSU is more. UC is even more, and the class size, look at the class size. You come out of high school where the class size is probably 35, 40. You do get attention from your professors. Then when you straight go into UC, there are about 400, 500 students, the classes, especially the beginning classes that you have to take, the prerequisites that you have to take. There are about 400, 500 students, and there are multiple sections of that. So the grading system is always a bell curve. You never get to see your professors because they are teaching 500 students. They can't remember. Whereas in a community college, there are only 25 students. We give a lot of personal attention. The students get a lot of personal attention. And CSU is also not very bad. It's 80 to 100 students, and so on. And the cost is something that it is staggering cost, especially in UCs and CSU, which is increasing every year. There are some more differences here, that a community college is primarily a teaching institute. All professors specialize in teaching and not research. Ours is mostly focused on student success. We take care of our students, provide nurturing environment, and we provide also support in many ways, many different ways, from tutoring, supplement instruction. There are many different ways and we can always see our students during our office hours. So you get to know your professors one-on-one because we have very small class size. The approach to education is always by connecting with the students on a personal level. There are many students who work part-time. There are also students who work full-time and then go to college. So we do connect with them on a personal level and provide opportunities so they can succeed and then transfer out to a 4-year college. UCs and Cal, they are more focused on research and the personal attention to the students, especially undergraduate. The first 2 years of undergraduate, when you are taking your 100 level classes and 200 level classes, they are not even taught by the full-time professors. They are mostly taught by adjunct. So the connection will be a little less. And CSU comes in between the two. Now you might say, what about the research opportunity that I'm going to get at UC? I won't get that research opportunity in a community college. So I want to tell you that is not true. That is not at all true. We send our students for summer research to Cal States, UCs, and also out of state, many different places. So there is research opportunity. If you choose to work in a Cal State Long Beach, for example, in one of the summer research, and you want to continue, then you can continue because you're living locally. It's not that difficult. So students have done that too. What is the similarity? All three systems or paths, they will help you reach your goal. No matter which path you take, you will reach your goal. And timing will also be between 4 and 5 years. Everywhere it's between 4 and 5 years. And you will get a degree in your chosen field. That is guaranteed. Now, who should go to UC straight away? See, some parents might say, why can't my child go to UC? Why? My child is very bright. So there are some things that you should know about. If you want to go to UC, you should be very sure about your major. You cannot be spending 1 year trying to figure out what your major should be and what you should do, because that costs a lot of money. So the reasons are you know you're sure about your major, where you want to go, what you want to do. Some students are very good at that. You do not want to stay at home. You have been at home. You want to go a little bit away from parents, have your independence. That can be another reason. You should be able to handle the rigor and the stress that UC offers it to you. You should be ready to be on your own. Your parents are not going to be with you at a UC system. You have to realize when to have game time, play time, when to focus and study. There will not be a mother or a father telling you, oh, time to study, you have a test tomorrow. So you are totally on your own. And you should have financial resources available to attend UC system. Who should go to community college? Not very sure about the major, and you want to explore. So it's a much cheaper way of exploring, finding out where you want to go, what you want to do. So it provides that opportunity. And those who like more attention, they tend to do better in a small classroom environment. They need more resources to succeed, like tutoring, helping outside the classroom, organizing your time management skills. Professors at community college, they do teach that. And you do not want to accumulate too much of loan. And do not mind staying at home. And this will also give you an opportunity to work a little bit. And you can gain some work experience while you are going to college. One thing I didn't put it there, but sometimes when we are in high school, sometimes we don't know what life is going to bring, not focused, not have opportunities, and we don't do well. And then it's hard to get into UC. Then what's the choice left? The choice is go to a community college. You will mature, and then you will also get a chance to improve your GPA, and then transfer out after 2 years. Who should go to CSU system? You're sure about your major, but not exact major. You're sure that you want to go into engineering, but don't know what branch of engineering. You need to decide that by the junior year, what branch of engineering you want to go in. Want to live at home and attend the college, that's also another option, and it is also more affordable than UC, a lot more affordable than UC. And you do not like very competitive environments. Some people do not like high stress, rigor, competition. Some survive in that, some thrive in that. So you are the best judge of yourself. And you, if you cannot find out, you can talk to people and your teachers, and they will help you decide also. So about community college, it provides two pathways. One is it provides vocational degrees, technical education, and nothing wrong with that. People do really well. And then second is transfer degrees. We provide 2 years of college. When you finish, you get associate in science transfer degree or associate in arts transfer degree. Once you get that degree, it is mandatory for California State to give you admission in one of their colleges, UC or Cal State. It may not be of your choice, but your admission is guaranteed. State has to provide that. So students complete their requirement in 2 years, mostly in 2 years. And then when you transfer out, the number you'll go as a junior, competition is a little less. How many people apply to UC as juniors? Competition is less. The number of seats available also can be less, but competition is less, and it's mandated. They are mandated by giving you admission. All our classes, all the community college classes are accredited with UC and CSU system. What about private? It is also accredited with private universities as long as it is in the state of California. Then your question might be, what if I go to another state? You can go to another state, and we provide our syllabus, the books we use and everything that you can take, and they will see that, and they will give you credit. So you can also go to a private college in another state. But our state has pretty good education system. There is no need to go to another state. UC Berkeley, UCI, UCLA, they are all very fine institutions. So it says all courses are articulated, less competition to get in as a transfer student. And also, because you're going as a transfer student and you have finished all your prereq courses, it is not hard for you to get the classes that you want. Counseling is available at community college. You can see your counselors every semester or even twice. They provide the pathways. They set up your entire course outline for the 2 years. Summer research opportunity, one-on-one interaction with professors, campus clubs. We also have lots of campus engineering club, science club, all kinds of campus clubs and in related fields are available where you can participate. And since competition is less, you can also get some administrative experience easily by becoming presidents of those campus clubs. And it looks good on your resume when you transfer. So here, many people think that community college students do not go places. So here is an example of community college students. This is from my experience in the STEM field. I had a handful of students going to Caltech. I have students going to UCLA, UCI, UC San Diego, Berkeley. Many students went to Berkeley. Cal Poly Pomona and Cal Poly San Luis Obispo. Cal Poly San Luis Obispo is considered as #1 in engineering for bachelor education, actually. It's way above, for bachelors, way above some of the UC systems. And their students do fantastic. I had students who went to medical schools after finishing their degree. It's their transfer students. And since we know the students very well, it's very easy. It's easy for you to get recommendation letters from your from your community college professors than your UC professors. I have students who have done PhD at Yale, Harvard, Stanford, UC Davis, and UCLA. And also some people went to play Major League Baseball. So we have accomplishments in all those fields. Community college students also do very well. I just want to tell you that it's not like you're not getting a good education. That's not true. So I will be available to answer questions. And I also have a notepad where you can write your name, email address, if you want to have one-on-one session with me. And my email address and everything is there. Hari Om, and thank you for listening.
Thank you so much, Brinda Aunty. That was very, very helpful and educational. I think we've had a request from some people to have an immediate Q&A right now, rather than waiting till the end or doing it in between sessions. So I'm going to invite particularly our high schoolers to come on up. If you have a question, stand in line so we can just go quickly. Or of course, our parents also, please come up. And as we're waiting for you to come up and ask your questions, I'll just say a couple things. One is, we've been in your seat. So juniors and seniors, there's many parents in this audience who were in exactly your seat 20 years ago. So we get the pressure, we get what you're feeling, we get some of the impact you may be feeling from your parents or from yourselves or your peers. So I think it's really, really helpful to hear what Brinda Aunty said is you have options. You have a lot of different pathways. You may have one particular goal in mind, but it's nice to know that there are many pathways to get there. So I really want to emphasize that. I think that was awesome. I also want all my friends who've gone to UCs, Cal States, community colleges, can you all raise your hands? Back bench, I'm looking at you. Raise your hands. So high schoolers, turn around. Those are all the uncles and aunties who can help you. So if you're wondering who has gone to these schools, who can tell us what it's been like, go hit them up, okay? We're here for you. This is what community is all about. So you can ask us, what did it feel like to live on campus? How did you do your laundry? You can ask us all those questions, okay? So I expected to see a couple people here. I don't see anyone. Don't be shy. Come on. Get on up, get on up. Any parents? Brinda Aunty's here for a few minutes before we go on to the next one. Thank you. Come on up. And friends, you can start assembling behind him. Nice to see a familiar face. Come on up. Come on.
First of all, thank you so much for your time. I appreciate it. A couple of questions. Everything else remaining the same major, all of that. Can you talk a little about placement opportunities? So somebody that went to a UC, somebody that went to a Cal State, if a company is potentially choosing one over the other, do they kind of look at, well, you went to a UC or you went to a Cal State? Can you talk a little about that? The second question I had was, let's say you went to a Cal State for 2 years. Can you potentially transfer out from a Cal State into a UC, just like you would in a community college? Thank you.
About opportunities for work, there is actually some of the Cal States, like Cal Poly Pomona, San Luis Obispo. After bachelor's, they have very good chance of getting into any of the major companies. If the companies are looking for somebody who can join their group and do hands-on work right away, they will choose Cal State people. If a company is looking for somebody who can do number crunching, designing more on paper, more using computers, not hands-on, not manufacturing, more not production, and they want more R&D, then they will go in for UCs. So companies, they know their Cal State institutes, their California institutes very well. And they all have many of them have gone through our system, so they know exactly what kind of education they are getting. So that is the difference. And as you know, that we Indian parents give a lot of financial support to our children for going into college. That is not true for many other people. So students, a lot of students work their way through college. So if a person at Boeing or Raytheon looking at your resume that you went to community college, progressed to UC Berkeley, got a degree, then they'll immediately say, oh, I also did the same thing. I also went to Cal State. I didn't have support. And that's a great thing. When I sat through the interview process, I realized how much community college is appreciated. Most of my fellow faculty members, they said this shows that the person was determined to be successful. And no matter what the problems were, financial or other kinds, but made it a point to succeed by going through community college and not thinking that this is below the standard. So, second one was a transfer, okay. Cal State to UC is difficult. See, you can go, but they will not do your courses will not be transferred. Because every university wants to make money. They would like you to take courses over there. So the Cal State to UC transfer is not as guided as community college to UC or CSU. Within CSU, you can transfer. Say you got into Cal Poly Pomona, but your dream is San Luis Obispo. After 1 year, after 1 year of studying at Pomona, you can transfer to San Luis Obispo. What is the guarantee that they'll transfer all your courses? No guarantee. They will decide.
I'm sorry, unless somebody else has another question, one last question. What about somebody that wants to go to a community college for 4 years?
Oh, community college does not offer degrees.
Oh, okay.
It's only 2 years.
So you're forced into going into a UC system.
That's
Thank you.
right.
Thank you.
Students, children of 11th and 12th graders, don't feel the pressure. Ask your questions. You can freely ask your questions.
I heard this that in universities they usually form strong bonds in the first year, and so the people who come transfer right in the third year, they find it difficult to collaborate with their fellow students. Is that a hindrance to education?
That is true. That is true. It depends on the personality of the students. Some students are very open, and we also tell them that when they transfer out, this is the first thing we say. We say, make friends. Make a lot of friends. You made friends, all your friends may not be transferring to the same place. So as soon as you go, you find out. And they figure it out. It's a little bit of a struggle the first semester. We always tell them in the first semester, do not take any overload. Take minimum number of courses that you have to take. There is a big adjustment. So, and sometimes their friends go with them. So it works out. And by the time they are matured, they are not 18-year-olds. They are now either 20 or 21. And that maturity helps. And they have been in different situations. They know how to handle it. So the situation is completely different because of the age and the maturity.
Thank you.
And, sorry, this will be our last question. Thank you so much.
Brindaji, thank you so much. My name is Rao here. Going into the route of medical schools, from that point of view, going into two-year community college, going into the UC, applying for the MCAT and that whole grade system, when someone in the medical admission, when they're looking at the profile, how does it differ going from 4-year UCs versus step-by-step approach? How do they look into those kind of things? Number one question. Number two, part of the same question is it special environment for MCAT training or that kind of a mindset in community colleges in the first couple of years they provide? Somebody who has that mindset to go the direction.
We have some students who already have like degrees in computer science or history and things like that, and then they come back to community college to get prerequisites and then go into medical school. So we do have some, not much MCAT prep classes. We don't provide that. We can help out a little bit in the structuring, but it's not we don't provide. I don't think UCs have MCAT classes either. So we don't provide any MCAT classes. Going to medical college, from community college to university to UC, it's the degree, it's the university from where you have your last degree matters, not the path that you take. Actually, if you take you can always explain why you went to community college in your personal statement. And it is how you present yourself that decides your path, not the name of the college and not the UCs and all that. It doesn't matter. So Cal State system students have done very well. Also, we have MD, PhD students, and we also have a joint medical program where they do get masters in medical and MD, both. So we have had success. We have no problem there.
Another round of applause for Brinda Auntie. Thank you so much. I just want to remind everybody that she'll be here after the session. My 11th and 12th graders, raise your hand. Don't be shy. We really want you to meet her afterwards, okay? This was meant really for you. I'm glad the parents came up and asked, but this is really a chance for you to be able to talk to her and get some opinions. Again, reach out to any of us also if we can help you on your journey. One thing that I'll add is that myself, my husband, many of us went to UCs, and we all then went to onto careers where our coworkers were from a gamut, of different colleges, small Midwest colleges, liberal arts universities. So it doesn't matter necessarily where you come from, but employers always look at your work ethic and what's your hustle. So I think keep that in mind, right? This is not going to be your end-all, be-all. It's a stepping stone. And I think it's very appropriate that Sudhaker Uncle is going to be talking about heart health, because I can see the BP has gone up for every parent in the room. So we're really glad, Uncle, that you're here to tell us everything will be okay. Everyone, please welcome Dr. Sudhaker.
Thank you, Brinda ji and Anita. And my name is Bharat Anand. If you don't know me, I'm one of the R1 parent and volunteer. So our next topic is on health, which is also very important for all of us. And do you know we have a CMLA physicians, healthcare professionals group? We have 200 plus members. So we started that last year in the goal of helping our community and mainly the students. I know some parent asked question about medical college. That is the main purpose of the physicians group. They go to 11th and 12th graders and mentor them what they look for when you want to get into medical school, and internship opportunities, job shadowing opportunities. We had a couple of guest speakers last year, and we had a Zoom sessions to talk to a lot of physicians. And this year, Dr. Purnima, Naval College has taken over the lead. And Purnima, to lead that, volunteer her time with her busy life to lead that initiative this year. And she's already volunteered to mentor some of the high school students here. And Purnima works as a neuro-oncologist in Chalk and UCI. And she has a 10-year-old who goes to Balviar here. And her husband, Saurabh Chivani, also volunteers with the same initiative and other events here. And he is a pediatric critical care specialist in Loma Linda Hospital. I welcome Purnima ji to come and introduce our next guest speaker.
Hari Om, everyone. Dr. Sudhaker Nayak is a licensed physician in the state of California, Maryland, and Michigan. He's currently practicing as a cardiologist, and he's director of the cardiac catheterization lab at PIH Hospital in Whittier. He did his MD in Osmania Medical College and residency in internal medicine in Prince George General Hospital, University of Maryland, and cardiovascular fellowship at Wayne State University in Detroit, Michigan. He's a long-term member here at CMLA, and he has volunteered here at CMLA. He's a member of the foundation committee of CMLA. Both his sons and daughter have either finished or are finishing their practice as physicians themselves. And they graduated from Chinmaya Mission Bal Vihar here. Thank you so much, and please welcome Dr. Sudhaker Nayak.
Thank you for that introduction. Let me see. Okay, I'm a practicing cardiologist. Can you hear me okay? Okay, there it goes. Okay, yeah, maybe use. So I'm a practicing cardiologist, and I've been in clinical practice for approximately 35 years. And I first came to this country in 1982 and started my internship here in a Washington, D.C. area hospital. And there you go, I'm here now, many years later, kind of reminiscing about my own education and the journey. So not that much pressure now, but I can see what Brindaji had talked about. But anyway, coming back to my talk, shifting gears here, in the first year of my internship in 1983, an event happened that kind of is leading to this talk today. There was a young Indian gastroenterologist who was from Chennai, and his wife was my colleague in the same year. She was a first-year intern, and he was, I think, about 5 to 6 years older, and young, vibrant gastroenterologist suffered a massive heart attack at age 36, got admitted to the coronary care unit, and I was the intern there in that hospital. And he was in the hospital for approximately 3 weeks, then was discharged, kind of recuperated for about 6 months. He was never the same again. Gave up his practice, was doing part-time work. And so that left a long, sequelae of his disease that he suffered. But nevertheless, as a few years went by, we started noticing in my own practice and during my training that a lot of Indian physicians have the same problem. So they were younger, they were looked very healthy, very active. They were in their 30s, 40s, and early 50s. They were having heart disease and heart attacks. So initially we thought that this was a lot of stress, change of dietary habits for the diaspora who immigrated from India, but many of them were all vegetarians, very active, and so on and so forth. And so a lot of physicians got involved and tried to look at data. And there was one particular physician, his name is Enas, E-N-A-S, E-N-A-S. A gentleman, a physician who was an early settler in this country in the 1960s, was from Kerala. And he looked at all physicians and had a study just among physicians. We would send out a questionnaire, and we'd fill up the questionnaire, and he had a data bank of physicians. And he followed them longitudinally for many years. And he quickly looked at the data, and there was a 4 to 5-fold increase in the incidence of heart attacks among Indian physicians. When they looked at Caucasian physicians versus Indian physicians, we were outliers. So then they instituted bigger studies, and there is a big study. It's called the coronary artery disease in Indians. It is, if you Google it, you can see it. Dr. Inas is the medical director for that project, still very active in that role. So what they found is that the Indian diaspora is very predisposed to heart disease. So it's a grave problem among Indians and not only Indian physicians, but the Indian diaspora. Like I said, there is a 4-fold increase in the risk of heart disease. And this is from coronary heart disease. And there are 3 major coronary arteries which supply the heart muscle, and they can get occluded, and the process is called atherosclerosis. And if you look at the data, heart attacks in the Indian diaspora occurs almost 10 years earlier than the Caucasian counterparts. And 50% of the heart attacks occur before the age of 50. In the Indian diaspora, we have this Indian community physician groups. We call it the 50-50 rule. What is that 50-50 rule? 50% of the heart attacks in Indians occurs before the age of 50. And the mortality is very high. When the Indians have heart attacks, their mortalities can be as high as 40%. And if you look at Caucasian counterpart, the mortality is 10 to 15%. Why is that? Because they have very advanced heart disease. There are multiple blockages in all the arteries, and so the prognosis is poor. So the next slide, please. Okay, so let's look at prevalence of heart disease among different ethnic groups. If you look at South Asians, that is the Indian diaspora, it is 10%. That's the prevalence of heart disease among Indians. If you look at Caucasian white population, it's 5.4%. And among the Chinese, ethnic Chinese is 2.4%. So let's contrast South Asians, Indians versus Chinese. Okay, we are at 10%, they're at 2.4%. South Indians many of them are vegetarians. They don't consume red meat, whereas the Chinese consume red meat. 100% are carnivores. They eat everything under the sun. And they smoke, though. They smoke more than Indians. Yet, their incidence or prevalence of heart disease is only 2%, and we have a 4-fold increase in prevalence rate of heart attacks. And to put it in perspective, we have about 4 million people, I think the last time I looked, between 3 and 4 million Indian people coming from the Indian subcontinent, and 10% of them have heart disease. That is 400,000 to 500,000 people. That's a lot. So that's the data. But when I looked at data from India itself, 17 million people died of heart attacks in 2011, and that's almost half the size of California. That was in 2011, so there's even much more now. So let's go on to the next slide. Okay, like I said earlier, South Asians and Indians have much more severe heart disease. It occurs 10 years earlier than other ethnic groups. High mortality, and remember, this is the #1 cause of death in South Asians. So if you can conquer that, you will live forever. Okay, so what are the traditional risk factors for heart disease? What causes heart disease? And this is what we were taught in medical school. Nothing has really changed. The traditional risk factors we talk about is high blood pressure, diabetes, high cholesterol, obesity, increased abdominal girth, smoking, and sedentary lifestyle. If you look at all those things at the top of the slide, except the genetics, there is some good news here. The good news is every single one of them, except the genetics, can be modified. With genetics, you can do nothing because you can't choose your parents. If both of your parents have heart disease, there's a high likelihood that you may acquire that disease. But in terms of high blood pressure, diabetes, high cholesterol, and the rest of the things down to genetics, you can't modify genetics, but every single risk factor is modifiable, and that's good news because you can either prevent development of high blood pressure or postpone the onset of diabetes or even cholesterol. And if you have it, you can modify it with medications and lifestyle modification and diet and exercise. So that's the good news. Okay, the next slide, please. Okay, a word about high blood pressure. We have a 70-70 rule. It's widely prevalent in the population. The 70-70 rule is by the time you're 70% of the population have some kind of blood pressure, elevation of their blood pressure. And unfortunately, high blood pressure is a silent killer because a lot of young people in their 30s, 40s, and 50s are walking around. They don't know they have high blood pressure. They have high blood pressure and systolic blood pressure of 160, 170, 180. That is because blood pressure does not produce any symptoms. That is why we call it a silent killer. And the good news about this and the bad news or good news, it can be easily treated, very easily treated with lifestyle modification, decrease in salt intake, and also with medications. Once you get your blood pressure under control, and once the blood pressure normalizes, your risk drops dramatically. So the other thing I want to point out is high blood pressure causes end organ damage. It damages the heart, it causes heart attacks, heart failure, it causes an enlarged heart, bigger is not better. And also high blood pressure can cause strokes, can cause kidney failure. You might end up on dialysis if you have kidney failure and so on and so forth. So let's look at diabetes as an entity. It's one of the major risk factors for development of atherosclerosis and coronary artery disease, not only in South Asians, but in populations all over the world. And if you look at the prevalence of diabetes, look at the prevalence in the white population, 11%. But unfortunately, in the Indian diaspora, there is a 23% prevalence of diabetes or pre-diabetes. So 1 in 4 Indians in North America have diabetes or pre-diabetes. And the bad thing about diabetes, it drives multiple risk factors. When you have diabetes, there's a propensity for you to develop high triglycerides. And there is a good cholesterol, what we call HDL cholesterol. When you have diabetes, the HDL cholesterol goes down, because once your HDL cholesterol goes down, you lose that protective effect. It increases the bad cholesterol, which is called the LDL cholesterol. Diabetes itself causes inflammation on the inner lining of your arteries and kind of promotes atherosclerosis and narrowing and hardening of your coronary arteries and other arteries in the body. Okay, so looking at different subtypes of cholesterol, when you go to the primary physician or when you get your blood drawn, your cholesterol may be reported as total cholesterol, but there are several subfractions or subtypes of cholesterol. I want you to be aware about these subtypes. Today's talk is about being awareness. You can build knowledge brick by brick. So if you break down the total cholesterol, there is we get what we call LDL cholesterol. It's a very toxic substance to the inner linings of the arteries. In excess, it damages your arteries and causes atheroma and atherosclerosis and narrows down your arteries. And L stands for lousy. HDL is a good cholesterol, and H is the healthy one. You want more of it and less of LDL. There's a third type of cholesterol or a sticky substance that is circulating in your blood. That is the triglyceride. It's not good for you. So, like I said earlier, that is also increase in the setting of diabetes. Okay, there's an entity called metabolic syndrome. It's not a fancy term. It is rampant in South Asians. We are not surprised. When you look at the waist circumference, you don't want your waist circumference to be more than 35 inches for men and 31 inches for women. When you have this criteria of increased waist circumference, and then if you add 2 of the 4 following, if you have high blood sugars, in other words, if you have diabetes, if you have high triglycerides, if you have high blood pressure and low HDL cholesterol, that constitutes metabolic syndrome. And we talk about that in our medical community. Once you have metabolic syndrome, it propagates a narrowing of the arteries, and your atherosclerosis can get worse. But it is easily modifiable with lifestyle changes, medications, diet, and exercise. Okay, next slide. Okay. A word about childhood obesity. A lot of children here in our community, and increased obesity and childhood obesity can lead to high blood pressure, high cholesterol, and diabetes, especially in the adolescent age group and subsequently in adults. And there are approximately 3 million cases of childhood obesity recognized per year in the US. And we see the epidemic of childhood obesity in all communities, all countries, even in India and also in the Indian diaspora. And the main cause of this childhood obesity is sedentary lifestyle, too much video games, cell phones, and also television viewing, and not enough exercise. And you are consuming a lot of energy-rich, dense, caloric foods and processed foods and so on and so forth. And this can be modified also, but if childhood obesity is not treated, it predisposes to heart attacks and heart disease later on in life. Okay, interestingly, as we all know now that the Indian diaspora has a propensity to have early heart attacks, and I call it the Indian paradox. Look at the slide lower down. It says 50% of the American Indians are lifelong vegetarians. 90% do not consume red meat. They are not very obese. They are skinny. They don't smoke. Yet, there is a very high incidence of heart attacks and heart disease in this population. Why is that? So, then why the higher rates of heart attacks? And that's the question. This particular group of people, the Indian diaspora, have a very high incidence and prevalence of diabetes and pre-diabetes. We have almost 2 to 6 times higher rates of diabetes in our community. And there is a phenomenon of insulin resistance. Insulin is a hormone secreted by the pancreas in your body, and insulin is necessary to control your blood sugars. If you don't have enough insulin, you develop diabetes. But unfortunately, in the Indian community, lack of insulin is not the problem. We are actually producing more insulin than we need. So what's the problem? The insulin that we produce in the Indian community, many of them, not everybody, is not very effective. It's called insulin resistance, and it does not fulfill its function. Insulin is supposed to get the glucose and blood sugars out of the bloodstream into the cells, but this insulin is not very effective. And one way to really modify that is by exercise. When you exercise, all the glucose in your bloodstream gets into the cells and your blood sugar drops. High blood sugars are very toxic to your blood vessels. You develop all kinds of complications when you have high blood sugars. So if you have excess insulin that is not effective, that's not a good thing. And I also want to talk about the skinny fat phenomenon. We as a race are not very obese. We don't find that many 400-pounders or 450-pounders, which I see in my practice every day, Caucasian, African-American. It's not unusual to see many of my patients are in that range. But we don't find that in the Indian community. What is the skinny fat phenomenon? An average Indian male is about 5 feet 7 inches tall, weighs about 140 pounds, yet they have a very high propensity to develop heart disease. What they have is what we call abdominal obesity. In other words, if you look at them sideways, they are skinny, yet they have accumulation of fat in the wrong places, especially in the abdomen, including women. So what happens with this abdominal fat? This particular kind of fat is not in your abdominal wall. It's not in your abdominal wall. It's inside your belly. It's around the organs inside your belly, around the liver, around the bowels, around the liver. And it's interesting that when I was in training in Detroit, I was a cardiology fellow. A general surgeon was a Caucasian who would come up to me. Hey, I operated on one of your Indian guys, 40-year-old. I took his appendix out. I opened his belly, and oh my God, what an amount of fat all around the organ. That doesn't look healthy to me. This was 30 years ago. So in any event, that visceral fat that you have around the organs produces a lot of inflammatory hormones called cytokines and interleukins that destroys the inside of your arteries. So that's the problem. So you may be skinny, but you can have this paunch or abdominal fat that is very toxic to the system. So be aware of that. So let's look at the cholesterol profile of the Indian diaspora. they have high triglycerides, not everybody, but there is a higher incidence of high levels of triglycerides, low levels of the good cholesterol, HDL. And one thing I want you to look at is this LPA level that is coming to the forefront now. Not many people are aware. There are several papers now that have been published that Indian diaspora has this high. It's called lipoprotein A. It's a protein molecule that carries cholesterol. When you have higher levels of LPA, that can cause heart disease and heart attacks. Okay. Okay, just a few words about the symptoms of heart disease. What are the symptoms? I see patients in my office every day, and in the hospital, people come to me with chest pains. Not all chest pains come from the heart, but when they come from the heart, there's a typical characteristic to it. People complain of this chest pain. This is called the Levine sign. They say, oh my God, I have this pressure, a feeling of tightness, heaviness, somebody's sitting on my chest, I can't take a breath, it is going down my left arm, and that's the classic description. Unfortunately, that's not every patient presents that way. It's about 30, 40%, but many of them don't present that way. Some of them may come to us only with left arm pain, sometimes right arm pain, some shortness of breath, sometimes heartburn symptoms. And women are very different. They do not have this classic symptom. They may primarily come to us with heartburn. We kind of say, we blow it off and say, there's no problem. I have some aching in the shoulders. Sometimes they have jaw pain, some tooth pain. So women, as we come to know now, they present very differently. And so obviously there's no lack of awareness. They go into the emergency room, they're sent home. Really they are having a heart attack, and they come back with complications. But anyway, so testing for detection of heart disease, there are several ways to detect heart disease early. One of the ways to look at your heart is to look at what we call coronary CT angiogram. It's a CT scan of the chest. Get a CT scan of the chest. It look at your heart and the arteries, and we can see where the arteries are patent or clogged up. We also look at the calcium scores on your coronary arteries. If they have high calcium scores, that tells us that you probably have blocked arteries. But the beauty of this test is that if you have a completely normal CT coronary angiogram, then you're home free. There's what we call negative predictive value. In other words, if it's normal, you're home free, off to the races. So we can also detect coronary disease with stress testing, put you on treadmills, and so on and so forth. Okay. What about prevention of heart disease? Dietary modification is a keystone for prevention of coronary disease. A lot of us are vegetarians, but I say vegetarianism is really a myth, because you think you're a vegetarian, but you're eating all the wrong kinds of food, fried food, processed food, and all kinds of food. That's not really vegetarian. That's more harmful than consuming red meat. Okay. No, go back to the last slide, please. It's important that you avoid processed food. Anything white can be harmful. Wheat flour, sugar, and salt, that is white. They can be harmful. Consume whole foods. Important that you consume whole grain, multigrain cereals. But importantly, most importantly, pay attention to legumes, lentils, and beans. High protein, powerhouse for micronutrients, protein, and high fiber. Does a ton of good for your body. There was a recent article in Wall Street just in the last week about beans. Look it up. Fermented yogurt, especially Greek yogurt, is very rich in protein. Concentrate on protein, avoid processed food, avoid Indian sweets. Next slide, please. Okay, weight loss is the paradigm of preventing coronary disease, but look at the BMI there. That's for the Caucasians. You want your BMI to be closer to 21. Now, we don't go and talk about obesity, fat, and all that. We talk about weight optimization. Optimize your weight, BMI 21, okay? And exercise also is the keystone for longevity and good health span. Aerobic training is good, but more importantly, pay attention to resistance training. Lift weights. Lift weights, especially after 40, don't lose muscle mass. Muscle mass is critical to, have your blood glucose come down. It goes into the cells. More the muscle mass, less the diabetes. Okay, and if you end up having diabetes, high blood pressure, high cholesterol, get aggressive with it. Do all lifestyle modification, exercise, diet, and in addition, you may need medications. Smoking cessation is the rule. And alcohol in the 20 years ago, we would say red wine is okay. Now, no amount of alcohol is good for you. Alcohol does not do any human being any good. If you don't drink, don't start now, okay? If you have to drink socially, maybe in moderation. Okay, stress reduction is vital, very critical. Chronic stress produces increased cortisol and other hormones go up in your body, adrenaline and cortisol, and that raises your blood sugar, raises your blood pressure, not good for you. Think about yoga, meditation, mindfulness, good for you, good for the body, and get into faith and spirituality. Okay, questions and answers.
Thank you, Uncle. Everybody, big hand, please, for Dr. Sudhaker. Thank you, Uncle. I've got to say it's a little unfair to have this a few days before Thanksgiving because everybody was looking forward to their pie, and now you're telling us to moderate. But I think what we heard is still live your life, enjoy in moderation, lift some weights. I see some Chinmaya Mission exercise groups going to be forming here soon, so really appreciate that, Uncle. Can we have some folks get together? I think we have room for 2 questions. If we have any parents who want to ask about heart health or kids who want to ask for the sake of their parents, especially with college applications. Please, go ahead, sir.
Hello.
Not working, Uncle.
Can we increase the muscles again after the loss of...
Sorry.
Can we increase the muscles after the loss? I am at the 70, so can...
So the question is whether you can increase muscle mass after age 70. Okay, a quick thing about muscle mass, we as human beings tend to build muscle mass until the age of 40. And after 40, as a general rule, human beings starts losing muscle mass. We call that sarcopenia. Sarco is muscle, sarcopenia, penia is less. So muscle mass goes down. And as a result of this, remember one thing, when you have a lot of muscle, it acts like a furnace. You can throw anything into the body, and the furnace burns it out. So when you don't have muscle, your calories have nowhere to go except into wrong places. So muscle mass can be built. It is not as easy as when you're 20, 30, or 40. But it's important, one thing, when you're 70, first of all, preserve what you have. If you don't strength train, you're going to lose even more muscle mass. With a little extra effort and a good trainer, you can build muscle mass. You can put on probably 5 to 10 pounds of muscle mass, and that's a big deal. Okay.
My question was about LPA, which you said was new data. So how exactly, I'm a scientist, so if you could maybe explain the mechanism of action. Why does high LPA result in coronary artery disease?
Okay, the mechanism is still kind of conjunctural. We know that by association, LPA levels are associated with heart attacks, and not only in the Indian diaspora. It's a lipoprotein. It is toxic to the inside of the arteries. It facilitates transmission of this, what we call low-density lipoproteins into the cell. And there's a scavenging mechanism that's the HDL, takes away HDL, the good cholesterol, picks up all the bad cholesterol, takes it back to the liver, and the LPA is very closely associated in that circuit. And so that mechanism is gone, and then by association we know now that LPA is harmful, and so, but unfortunately we don't have many drugs to alter that. Exercise really doesn't influence it. None of the traditional cholesterol-lowering drugs like statin don't influence it. And so all you can do is attack LDL cholesterol, which is probably the final common pathway. But LPA itself, we don't have. There's one drug called bempedoic acid. It's a new on the market. We don't know what the long-term profile is. So sorry, there's not much that you can do about it.
That was useful. Thank you.
Yeah.
Thank you, Dr. Nayak. It was a fantastic talk, and we really appreciate your time. One thing, while our kids are here, one thing that kids can do or parents can motivate kids to do for a healthy heart. Thank you.
Okay. All I can say is that Kids need to be very active. Skinny is good. So you want to be physically active, go out there and play a lot, do a lot of fun things. Go out. You know, and when I came back from school in India, there was no structured play time. We would just dump the bags, go out on the streets and start playing. But here it's a little different and a little tricky. Either you're not either in school sports or not in school sports, then you have organized sporting activity. I think everybody needs to get involved in sporting activities. More the better, and you actually perform better in school and college when you're physically active. That's very important. When you're physically active, people think, oh, they're going to get tired, they have to do homework. No, they have to get that quota of physical activity. Takes you away from a lot of things like video games. I know you love it, but you can have some of that, some of video games, a little bit of that and TV and all that, but also get involved with physical activity. And the parents will, of course, take care of the, what they feed you and nutritious diet, and that's very important.
Thanks so much. Uncle, that was fantastic. I'm going to ask Brinda Aunty to raise her hand again, just so that you all can see her. So parents, if you just walked in or if you've been here, and of course my 11th and 12th graders, make sure you find Auntie afterwards. Uncle will also be available. They're very generously staying through the next session to speak to our two, of course, our friends there. So you can catch them and ask whatever you need to. I think I also want to give a round of applause to Bharatana, our uncle who arranged all of this. Can we give it up for him, please? I think we're really lucky to be a community who cares not only about what's inside our spirituality, but also our physical body as well and our emotional health. So what I really come away from this session is feeling we are here for you. Right? I think I want our high schoolers to really feel that in a deep way. We've got your back. You're not alone on this journey. And parents who are looking for heart health, I think find some friends who you can exercise with. I think that'll be pretty fun. A nice challenge for the new year. With that, let's go on.